Hello, it's Erica Jeffrey again. I am going to do my best here to show you how to do an NG insertion and sectioning, and I'm going to verbalize um, the difference for an NG stylet as well. And so this will be the patient. Um, Again, I'm just working off my bed here, and I might not have the right supplies, but I'm going to do my best to demonstrate for you. Um, First, what I'll do is I'll check the doctor's orders, and I would gather my supplies. I make sure it's the patient, and when introducing myself, hello, I'm Erica. I'm going to be your nurse, and I would look for 2 identifiers for the patient and also protect their privacy as well. I would educate the patient about their procedure and let them know that we are putting this NG in them so we can help put food in their stomach and also to give them medicine as well, and to their stomach from their nose. Yeah, so I would assess them. I would ask them to cough, and I'd see and check their gag reflex as well. I would see if I would find out if they need sectioning. I would put the SPO 2 on them, and I would make sure that they're in a high flower position as well. I would get a container with water or saline and sterile gloves and the suction catheter. And doing that, pretend that this is saline water. Okay, and then I would have the kit here, and I'd have it's supposed to be like a suction catheter kit. Put this in here as well. Okay, so I got my supplies and everything around the patient, and practice hand hygiene. And what I want to do is I'm going to first give them the proper, like, to suction it. So I'll get the suction kit out, and so we have our sterile gloves here. So that's my patient. So I put my sterile gloves on. Hopefully you can see that better. Okay. Put this on here. And come underneath. There we go. Okay. And so there's my sterile gloves. We'll move that. Sorry about my space. I really don't have that much room wherever I'm living at the time. Okay. Okay. So I would use my dominant hand. I would keep that accessible and keep that clean. Okay. I would have a saline bottle. I would have put it in. I would have had, because I know everything's kind of like, I don't know if we're doing the suctioning first, or if we have to do or if we're putting one in first. So to clarify that, I can't really, the instructions are a little all over the place, to be honest. I'm trying to figure this out. Okay, so I would do the suction. So I would have saline water, say in this, there would be a section in here that I could put water in, the saline. So I put that in there. And then I would take a lubricant, and I would roll, say we're going to use this as for the nose, okay, to be the NG. And we would have this hooked up to the suction, but I wouldn't be using both hands. We'd just be using the non-dominant one. And we would put that in the lubricant, and we would go down when we go into the nose there. I would make sure that when I put it down, it's going towards the side right here, and then try to put down more into the stomach. If I hit resistance, then I'm going to pull it up about 1 to 2 centimeters, and then begin suctioning, because I don't want to hit the Karina, right? And so, yeah, and I'm gonna be doing that for and then when I'm done, I'm gonna pull it out for 1 minute, and I want to make sure that their oxygen is up, right? The SPO is heightened, and give them a moment there so they can breathe and clear out in between each sucking. Okay, so, and this is really awkward. And then, so I'll put that back in the package here. I understand there is a sterile field. We shouldn't be touching anything. I'm just trying to do my best to explain the steps here and to practice. Afterwards, if I was inserting this, I would measure from right here to here and from the tip of the nose back right here, and we would mark it so then we know. And even when once it is in, we would have a piece of tape, right? So say it's like in this way, it's coming out your nose. We would have a piece of tape here. I feel like a one-on-one would be best. I'm trying to do my best with this video, but this is, like I said, this is awkward. I wish we had the labs in person. I would evaluate things, pre-insertion. The difference for the NG stylet and not is because there's risk of tissue puncture and or permanent or placement error, sorry. So yeah, we do these non-sterile gloves that are not sterile at all. I look forward to having a one-on-one with you, and thank you.